So hello everyone, welcome back to the session on rodent surgeries and rodent experiments for neural engineering. So in today's session, we'll try to cover a very important aspect in the entire rodent experimental methodologies, that is anesthesia in rodents. It's very important to sort of understand how and what sort of agents that needs to be administered, and then what are the risks that to the rodent's life that are there because of those drugs that we are using, and what methodology that you need to employ which is suitable for your own experiments. So it's very vital to understand the entire apparatus, how it works, and there is a significant learning curve, and there are going to be a lot of trial and error before you sort of finalize your setup, and hopefully this should help you, this session should help you in choosing a right way of anesthetizing your rat. And because of course it does require a lot of investment in the setup, be it for monitoring, be it for anesthesia, whether it is an injectional or inhalational. Do you really need those apparatus, and what are the advantages and disadvantages in each methodology of the anesthesia itself. So it's very important. As I said, this is going to be just the primer for the entire aspect of the anesthesia. Hopefully this should help you to have a good fairly good setup for the rodent anesthesia. So this is how we are going to decide the talk. We are trying to, in this particular session, let's try and look at the various definitions and abbreviations, then the pre-anesthetic evaluation and pre-anesthetic care and preparation. All these while we were discussing techniques, though it did involve a lot of medical terminologies and anatomical terminologies and jargons, you will still be able to do it because those are techniques which you need to replicate, which comes with practice. Whereas here you do really have to remember a lot of such terms, and unless you are really used to these sort of terms on a regular basis, and if you are not really really familiar with these terms, it's going to be really disastrous, because any mistake in the dose calculation or miscalculation for the drug timings, and you sort of choose a wrong drug and administer it in a wrong way, instantaneously it will kill the rat. So that's the reason that I sort of cover it a little bit in little bit extensively, so that at least around 30 to 40% if you can take a message from this session, it would definitely benefit in long term. So in next session we'll cover the other anesthetic equipments, administration, anesthesia, vital monitoring. So this is going to be a big module which is similar to surgery, because it is really equally important, which is going to decide the morbidity and mortality of the rat, because in surgery if something goes wrong you really can pinpoint, whereas in anesthesia if something goes wrong you really very difficult to pick it up if you don't have the right apparatus, if you don't have the right setup. So it's not only important to learn the techniques, it is also really important to have a right equipments and tools so that the entire anesthesia goes smoothly. All right. With that, a brief introduction to this module. I'll just quickly take you through various definitions and abbreviations, because we will be using it left and right throughout this session, and you all really need to understand every aspect of the of this particular session. So what is basically anesthesia? So aesthesia, or the later half of that word, actually means sensation. Anesthesia is loss of that sensation. All right. So this is often accompanied by loss of consciousness brought about by controlled reversible intoxication of parts of the nervous system. That's the textbook definition, but in simple words if I need to put it, there are two ways of inducing anesthesia. Alright, so that is exactly the reason why you really need to know what exactly is your objective. You really want to make some part of the body numb, then that is local anesthesia. If you really want to put the rat to sleep and literally unconscious, then that is general anesthesia. Alright, so this general anesthesia will have three components to it. The most important component is that the rat is unconscious with adequate analgesia. These are mutually exclusive. It does not mean just because the rat is unconscious it is not experiencing pain. That is indicated by the increase in the pulse rate. Okay, all of you are familiar with the pulse. There is a rate, fixed rate for it, so many beats per minute, which we will discuss when we go into the monitoring section. So there has to be adequate analgesia, the rat has to be unconscious. Another important component is that there is enough relaxation to allow for surgery, muscle relaxation. Alright. So muscle relaxation in rodent surgery is not really a big deal except for spinal surgeries. So in spinal surgeries, when you expose the spinal column, you will be dissecting a lot of muscles around. So it will be nice and easy to approach the spinal cord if your muscles are relaxed. So that is where the muscle relaxation really matters. For cranial surgeries, not many muscles are there, practically nil on the top of the skull. Alright, it is just skin and subcutaneous tissue, then the pericranium and right through the bone. Okay, but for spinal canal, there are a lot of muscles along the spinal column, which you will see it in the session on spinal surgery and spinal anatomy. There are a lot of muscles around. So once you dissect it, you need to maintain it with a lot of retractors. So you need adequate muscle relaxation. So these are the three important components which makes it very different from the local anesthesia. I am sure all of you must have visited your dentist. What they give is a local infiltration anesthesia, where only the gum is made numb so that they can extract the tooth or do some sort of a root canal therapy or various surgical procedures. So that is a classical example of local anesthesia. In general anesthesia, when they make the patient breathe those gases, anesthetizing gases, the patient or the animal goes unconscious, and that is the classical general anesthesia. But having said that, there are various injectable general anesthesia. So we will come to that in a moment. So that is about anesthesia. How exactly is the sedation different from anesthesia? Alright. So in sedation is if you take a spectrum of the consciousness, and this falls in the lower limit of the depression. Alright. Higher the central depression, higher the extent of unconsciousness. Okay. You are just putting the animal to sleep, slightly unconscious, but still it can perceive pain. Maybe the muscles are not fully relaxed, but it is sleepy. I mean, that is the right word. So mild degree of central depression in a conscious but calm animal, that is sedation. Alright. The animal is conscious, but it generally becomes more calm, activity definitely goes down, then that is sedation. So that is something also referred to as tranquilization, where you make the animal sort of cooperate, not generally out of its own will. Because of the sedation, the animal generally will maintain a limb in a particular position. You can maintain the body in a particular position when the animal is sedated. That is the whole point of using the word sedation. And another important aspect that you all need to learn and be familiar is these abbreviations, which are standard and which are most commonly used in all the medical practice and veterinary practice, and you will also see this in literature that is being used. So I sort of selected few of them which are really important. So these are all routes, alright, routes of administration of various drugs. Intramuscular IM, intraperitoneal IP, intravenous IV. Simple. Subcutaneous can be SQ or SC. PO is per os in Latin, so basically oral drug, alright. When they say NPO, alright, that is nil per os or oral, alright, that is you are going to keep the rat fasting, okay, nil per oral. So, PO is also pretty standard abbreviation. Q refers to every. So, where does this Q come? Here in the dosage. This particular drug has to be given every hourly. So, it is a Q into H or just QH. So, this Q refers to every hour or every day, or basically once in every hour or once in a day, that is QH and QD. So, BID, SID, all these have come from Latin terminologies, where the BID actually stands for Bissin die, alright. SID refers to Semelin die. These are Latin terminologies taken to English. There are lot of Latin usages in medical jargons, and that is how it has become complex. But then if you try to look at the literal meaning of what those Latin words actually mean, it makes more sense and it is easier to remember. So, bis basically twice, so giving medication twice a day. So, this can be written even BD or BID or BD, refers to twice a day. SID is Semelin die, so every medication given once a day, right. SID is once a day. So, PRN refers to as and when the situation demands, which is similar to SOS. So, Prorenata and Siopacete. So, that is the actual expansion of these abbreviation PRN and SOS. It is not the SOS of sailors, which are very different, alright. So, save our souls, that is another emergency beacon that comes in and various different situation, whereas in medical terminology SOS is Siopacete, which is giving medication as the situation demands. When they say you take this painkiller SOS or PRN basis, and this is what it means, as in when the situation demands. NR simply recommends, simply means not recommended, alright. So, these are some of the definition abbreviation which really keep coming in your way of learning these new techniques, alright. So, anesthesia, what exactly, so where exactly the drugs will act, and as I said it differs and depends on where you are going to use the drugs and for how long and what route you are going to use these drugs. So, generally if you take this classification, when we used the classification as general and local, alright. In general you will have some sort of a sedation or complete general anesthesia. So, whether you are injecting the drug intraperitoneally, intramuscularly or IV or inhalational, whatever route you choose based on the drug, based on the site of action of those drugs, it is divided into general and local, alright. So, for general anesthesia to act, it has to act on the central nervous system, always on the brain. It has to numb the brain and reduce the activity in the brain to cause general anesthesia, which will take care of analgesia and unconsciousness. The additional effect of these drugs is that the muscle tone also comes down. That simple reason being, the muscle tone is maintained by the higher order neurons, wherein the motor cortex impulses reaching the ventral horn cells in the spinal cord, for that matter the reticular activating system, specifically the vestibular spinal tract and reticular spinal tract, that becomes numb, and that is how the muscle relaxation is also brought. And there is a direct action of those, there are muscle relaxants that are used along with these general anesthetic drug, which will sort of aid the muscle relaxation, alright. So, In rodent, this is good to know that these are the injectable drug, ketamine, acetaminophen, dexmedetomidine, all these are injectable drug, and isoflurane and sevoflurane are the gaseous forms of anesthesia. Alright, these are inhalational, others are injectable, and these drugs are generally depressants. These are not really that strong, these are depressants. So instead of use morphine, tramadol and buprenorphine, these causes central analgesia. Alright. So this is the general breakup for general anesthesia and local anesthesia. And if you can see, there are various drugs in the local anesthesia aspects as well. If the drugs acts in the spinal subarachnoid space. So you all remember the spinal anatomy which we discussed. So there is spinal subarachnoid space. If the drug is injected into the spinal arachnoid space, it will act on the spinal cord and numbs the second order neuron. Okay, just to give you a recap of that anatomy, from the periphery to the spinal cord is first order, spinal cord to the brain is the second order. Alright, and no, sorry, second order is till the thalamus, then from thalamus to that is the third order neuron. Alright, so if it is acting on the first order neuron or second order neuron, you can use the spinal cord and the spinal subarachnoid space to numb the limbs, but still the animal will be conscious. Alright, so and if you want to give a local infiltration, that will act by transduction, wherein the local nerve endings are anesthetized, and then you can operate only in those area where the anesthesia has been infiltrated. If you use it in the subarachnoid space, then both the hind limbs will get anesthetized. If you use it in the cervical space, all four limbs will be anesthetized. If you are going to use it on the brain, then it is going to cause general anesthesia. Alright. So that is a sort of overview of the entire anesthetizing agent that we are going to discuss it in detail. So let us look at the differences of these inhalational and injectional. So in inhalational, as it is self-explanatory, the rat is going to inhale the various anesthetic gases, and in an injectable, obviously you are going to supplement it with the additional drug which is going to act on the brain and cause general anesthesia. So as I said, it can be used with inhalant gas or injectable drugs. Inhalant gas is preferred method of anesthesia whenever possible. For the simple reason, we will come to the disadvantages and advantages of these two methods, but then it gives a very smooth anesthesia for a longer time. That is the basic advantage of the inhalation anesthesia. And then whenever the inhalants are not possible, then the various drugs are combined to induce anesthesia, and these we have already gone through: general, local, and general you have inhalation and injectional. So what are the advantages of injectable anesthesia? It is definitely quick acting, and there are many routes which we can use, but commonly what we use is intraperitoneal, wherein it causes systemic absorption, that is from the peritoneum it goes into the blood circulatory system, and through that it reaches the brain, alright, to cause general anesthesia. So whatever route you use, what is going to be different is the bioavailability, that is the extent of drug actually reaching the site of action. In this case, the site of action is brain, alright. So if you are giving subcutaneously, what is going to be different is the rate of transfer of drug into the blood is going to be slow. So the slow onset of action and slow delivery of the drug into the system. So it might give us a benefit of long action, but then it is unpredictable and we really do not know when it is going to act, because the thickness of subcutaneous fat is going to vary from rat to rat, alright. So generally we prefer intraperitoneal route, which will give us the smooth induction, I mean as in compared to the other techniques of IV and IM. IV is pretty dangerous because you are injecting a large amount of drug into the blood directly, which can sort of suppress the brain so much that the breathing also can get compromised. All right. So there are many routes and it is easy to administer and does not really require any special equipment. That is another major advantage of using injectable anesthesia. But unfortunately the injectable anesthesia is less preferred because of its significant physiological impact. For example, the drug which is commonly used is ketamine and xylazine. All right. These are the two most commonly used injectable general anesthesia drug, which will have a significant impact on heart rate, all right, and intracranial pressure. Especially when you are doing a brain surgery, it is going to matter a lot when you use ketamine and xylazine. That is the reason why generally the inhalational anesthesia is used for various central nervous system surgeries or neural surgeries, because it is going to have a big hindrance and it can cause even death of the rat if not used judiciously, because it is going to cause central nervous depression and you are really going to operate on that depressed system, which is going to be really detrimental for the survival. And of course, as I said, less control of variables. You really do not know to what extent it is going to suppress the heart, to what extent the intracranial pressure is going to rise. So difficult, really difficult unless you have a very good health monitoring system. In spite of that, many deaths of rats have been reported when such drugs are used, and they tend to take longer recovery time because some drugs are going to be in the system for a longer time. All right. And then there is a variable effect from a single dose. So you really know, the literature say probably it will stay for 45 minutes, but sometimes it can get metabolized and rats will start waking up in the middle of the surgery within 15 to 20 minutes. So that sort of variable effect is reported for the single dose and with the injectable anesthesia. And of course, there are significant differences in the dosing, significant differences in how much you need to dilute and where to inject based on the strain and gender of the rodent that you are going to use. All right. So let us look at the inhalant anesthesia advantages and disadvantages. There is a significantly less physiological impact, but there is a good control of the anesthetic depth. That is very important. We will look at the term called MAC, that is the minimum alveolar concentration. Okay, alveoli, I mean for the non-biological category of students, basically it is an end organ of the, end pathway, I would say, where the air ends and where the gaseous exchange happens. This is a simple basic biological knowledge, where the lungs starts from the trachea, then it divides into bronchi, then it divides into bronchioles, and it terminates into the alveolar sac, where exactly the gaseous exchange happens. So there the concentration of drug matters a lot, and then the exchange is really smooth. So the depth can be controlled when you look at the various parameters, and there are various neural signals that can be used to control the anesthetic depth. And deliveries usually involves oxygen. So there the oxygen is taken care of. All right. So that is a major attractive feature, where it is generally mixed with oxygen. So there is no worry that, especially when you give an injectable anesthetic, you are injecting the drug and you can supplement with oxygen, whereas when there is a delivery such as this, the oxygen mixed with, and then there is a special equipment which is present to make sure that the rat breathes in, then this becomes really attractive. All right. And the recovery time is quicker. As soon as you stop the flow of the gas, generally the animal recovers within a predictable time range. And then there is greater consistency between the strains and genders. Of course, the major disadvantage is the cost of the equipment, which is actually the entry cost. That means it is going to be a one-time investment, which eventually becomes cheaper to use if you really look at the rats that you are going to lose with injectable anesthetic, the number of time you are going to use the drugs, and of course the delay that can happen, the damages that can happen if the rat wakes up in the middle of the surgery and you need to give the injections. Another major difference in the injectable anesthetic is you are going to fix the rat in the stereotactic apparatus. We will deal with this when we are discussing the the method of delivery. We always say look at what is the advantage that is offered by the inhalational. But yes, the cost is major problem, and it does require a scavenger system. So this is something where the extra gases that are spilled over, that has to be scavenged by the various anesthetic apparatus that are required. If that does not function, it does affect the operator, that is the user, that is you. If your scavenger system is not really good, you end up in sort of inhaling. I mean, the doses are going to be very small because it is a small animal experiment, but it has to have a robust system where this scavenger system takes up all the excessive anesthetic gases, and then it requires obviously a good maintenance with annual recalibration. So those are the advantages and disadvantages. So briefly, let us have a good walkthrough on the general anesthesia aspect, where you really need to have a state of total unconsciousness. So pre-anesthetic care and evaluation is significantly really significant to have this sort of outcome and the result. So choosing the animal and taking care of all these steps, which are simple and doable steps, which will sort of give a really good outcome. So acclimatization is very important. You plan your experiments and animals have time to settle before you actually submit. So at least 48 hours is what is required after transportation to prevent the stress related hormones affecting the performance of your various anesthetic drug that you are going to give. But generally, if you are trying to transport an animal, there is a step called quarantine. So by the time you quarantine the animal and then subject for experiment, then this really generally gets get taken care of. Or try to acclimatize within your behavioral setup box once in a while and put the rat in the induction chamber itself. I am introducing the word induction chamber, where the gases are introduced with the oxygen and put to sleep before you actually take it up and keep it in the stereotactic apparatus where the continuous flow of anesthesia happens. Alright. So acclimatization is very important. And then how do you select the animal for anesthesia? That is very, very important. Here comes the nutritional status of the rat. When the anesthetic drug is given to the rat, there has to be a good overall nutritional score, which is important, called body conditioning. So that is very, very important. So for example, BC1 is completely emaciated rat, where you can see all the skeletal structures extremely prominent. So this is available in literature, this sort of classification. It helps a lot to choose a well conditioned BC3 category, wherein your anesthesia becomes smooth. If it is obese, is also a problem, emaciated is also a problem. Obese will have a lot of fat in it, and that takes in a lot of these gaseous agents which will stay in it and they recover slowly. Induction is slow, there are a lot of changes, and obese rats will also be difficult to handle it surgically. Alright, so it should be neither over conditioned or it should be under conditioned and emaciated, which will not withstand any sort of extra physiological stress. Alright, the surgical and anesthetic steps are pretty stressful, and if the rat is already emaciated, it is not going to withstand any of these procedures. Alright, so that is very important. Choose the right body conditioning. So it is very important that your rat that you have chosen is definitely healthy and disease free. Alright, so how are you going to confirm that? So there are various parameters. Sorry, some part of the slides are missing. So basically here there are different parameters, that there is overall general appearance and the respiratory function, mucous membrane or skin coloration, extent of hydration, and body conditioning score should be between 2.5 to 3, which we just got familiarized in the previous slide. So the overall general appearance should be active, curious, smooth fur coat, all that will give us that the rat is healthy. On the other hand, lethargic, hunched, ruffled fur coat, all this will tell us that the rat is going through some sort of stress or probably even diseased. So, and the breaths are not noticeable, there are no discharges from nares. For example, tachypnea refers to increased respiratory rate, alright. Increased respiratory refers to tachypnea. There are deep abdominal breaths, shallow breaths, open mouth breathing, gasping. All these indicates that it is a poor physical status indicating the systemic disease. And the color of the mucous membrane, especially around the nostrils, and if you can open the mouth and see, the inside the lips or the tongue should be pink. If it is pale blue or bright red, all that indicates the systemic disease. And the skin turgor, which we will deal it with when we look at the health monitoring, there is something known as tenting, skin tent. When you pinch and leave it, the tent persists. That means there is dehydration going on. So that is what is called dilated skin turgor test. And there is a piloerection where the hairs are ruffled, and then the sunken eyes. Then of course the body condition scoring, which we just dealt it in the earlier slide. So these are some of the physical examination which you really have to go through methodically, and then make a note and then exclude that rat from the entire experimental procedure, which is very, very important, alright. So how do you really sort of prepare the rat for anesthesia? There is something known as pre-operative preparation, there is pre-anesthetic preparation, alright. So just before the surgery you paint and drape, you remove the skin, you drape the entire body of the rat. That is a pre-operative preparation. Similarly for anesthesia, you need to sort of take care of the eyes. The eyes will remain open throughout the procedure when the rat is anesthetized. So you need to apply the ophthalmic ointment and cover the eyes to prevent the dryness and damage to the cornea. And if the surgery is prolonged, you need to reapply it. So some part of the text is covered. Basically you are trying to infiltrate the local field with the injectable anesthesia, that is infiltration anesthesia, just to supplement and will bring down the requirement of your general anesthesia. Because when there is a pain, there is hyperventilation, it sort of tend to breathe more, and the autonomic nervous system comes into picture where the heart rate goes up, alright. To prevent all that, it is always a good practice, even if the rat is anesthetized, better to infiltrate before you cut the skin. So another factor that you need to consider is the sensitivity to various anesthetic agent. For that, this age and body weight matters a lot, alright. So that is the reason why you need to sort of maintain all your rat in particular age and body weight, so that you do not have to really sit and calculate all the time the various doses, and there is rat the inter subject variation is minimal. So for example, bupivacaine requires dilution which is accurately different for when you use it accurately, it is different for mice and rats. So this is an example shown here based on the weight of the rat. It is diluted to 2.5 milligram per ml with a maximum dose of 8 milligram per kg, alright. These are the various dosing that is available for bupivacaine, and you see that how the weight is increasing and the demand for the this particular agent goes up, alright. So that is the whole point, to choose the correct body weight and maintain it consistently between the different experimental subjects. So you need to sort of keep the animal warm throughout the surgical procedure, because heat loss is pretty rapid in anesthetized rodents, because as it breathes it loses a lot of the heat from the body. So warming the body is a very important aspect, and that temperature, body temperature has to be maintained, alright. The hypothermia is one of the parameter in the circle of death. Other two is like called triangle of death, the hypothermia, acidosis and coagulation, okay. So these three, the DIC, disseminated intravascular coagulation, that is these three features forms the triangle of death. So hypothermia is at any cost should be avoided by using a appropriate warmer, alright. And most importantly, we should never leave an anesthetized animal unattended. If your surgical setup is not ready at the time of anesthesia, you should ensure that entire surgical apparatus is ready, so that you can quickly transfer the animal and to the surgical apparatus and start your procedure, so that that anesthetized animal time is not wasted. Alright, is going to breathe in lot of anesthetic gases if you keep preparing the surgical setup after inducing the anesthesia. So that completes today's session on the pre-anesthetic evaluation, pre-anesthetic care that needs to be given before you actually subject the rodent for general anesthesia. In the next session, we will discuss in detail what are all the anesthetic setup that is required before you begin such neural experiments. For that matter, any rodent surgery would require this sort of anesthetic setup. So it is not really a waste to know this session, even if you are really not doing the full-fledged neurosurgery. Any surgery this would require. So it is very important to have a vital monitoring setup, general anesthetic equipments. So in next session we will go through that setup and then take up the actual general anesthesia procedures. Alright. So thank you all.